So we're here today to talk about 9 to 12 months topics for infant nutrition. The things we're going to go through today include building healthy habits to last a lifetime. We're going to go through some balanced meals for the whole family. Also discuss how often you want your, we call it pre-toddlerhood, your toddler to be eating in regards to meal and snack frequency, eating together and role modeling. Also, we're going to talk about cow's milk and when to introduce cow's milk and how you may go about that. We're going to talk about some supplements and other alternatives to milk. And then we're going to wrap up the session with talking about picky eating and constipation. So some common infant feeding issues that we come across working with families are some people get into a habit of sticking with baby foods for too long. So we're going to talk about when we want to start doing some texture transitions and how that might look, and why it might become a problem to not use that window of opportunity to do texture transition. We're also then going to talk about bottles and sippy cups, then talk about if you can have too much milk or juice and the nutritional effects that come from that, as well as developing skills of being able to self-feed. And then we'll go into other common issues about food safety and constipation. So this is kind of a visual of how we like to show parents how you're going to do some texture transition with your child. So at 6 months, we do full purees to get that iron in at that age. And then we try and use the time frame from 6 to 9 months to move from mashed, small chunks or finely chopped foods. Now what we're talking about is that 9 to 12 months is when we're really going to start having babe be a part of family mealtime, and they'll start to develop more adult-like eating ways and plates and how we're going to transition them that way. And so it is also around this time that we encourage families to start thinking about weaning from the bottle and trying to transition from the bottle to a cup and be bottle-free by around 12 months. But I'm going to talk with you about that a little more later. So just a visual of a sample menu of how your baby's day might look like at different stages, 6 months, 6 to 9, and then 9 to 12. So if you focus in on the 9 to 12 sample menu here, you will notice that your child's day is starting to transition more into well-balanced adult-like meals. And that's really good for them in developing better relationships with food, widening their palates, and also being included in the family meal times, just like everyone else. So lots of benefits of doing that texture transition. So how often does baby need to eat during the day? So babies have tiny tummies. A reference you can use is about the size of their fist is the size of their tummy. So it fills up quickly, but it also can empty pretty quickly too. So we do suggest that you plan a routine with your child for the day where you're offering a meal or snack about every 2 hours. 2.5 hours, and using your baby's hunger cues to know when they're full and when they're hungry. So sometimes, we may be feeling a little bit holding back on allowing babe to self-feed because of the mess that comes with it. Very common thing that comes up, and we understand the concern around that or the extra work that comes with that. However, children and babies are not going to learn how to self-feed and develop those hand-to-eye coordination for self-feeding if we don't allow them to get a little messy. It takes a lot of coordination and development in the brain to learn how to self-feed in a neat, tidy way. So we have to give them the opportunity to get a little messy on the way so that they get more comfortable with food and they learn how to do it just like us adults. When can I introduce cow's milk to my baby? So once you get to that 9-month mark, you are able to start transitioning baby into some cow's milk. We wait until 9 months because we want babe really well established on iron-rich foods before we introduce cow's milk. And that's because cow's milk can interfere with the absorption of iron. So we want babe just really well established on iron-rich foods before we start doing cow's milk. And we find by 9 months, if you've been following along, is the right time to start doing that. We do recommend homogenized milk. Babes need, up until they're age 2 or 24 months, they need the extra fat that comes in homogenized milk for growth and development. Goat's milk is a suitable alternative, but you want to make sure that it's pasteurized and also fortified with vitamin D and folic acid, as these nutrients don't come naturally in goat's milk. How much is too much milk for my toddler? So There is a such thing as too much milk for your toddler, although it's very healthy, gives us our calcium and, like we talked about, our fat that they need for growth and development. Some toddlers fill up on milk, which starts to affect their appetite for solid foods, and we have even seen that get in worse circumstances where it starts to affect their growth. Because they're not taking in a variety of other foods, growth can be affected, and also because of that interaction or absorption of iron, it has been reduced with having too much cow's milk. So really they need about 2 to 3 cups per day. So it's about 16 to 24 ounces of milk is okay a day. We usually recommend from that 9 to 12 months that the 24 ounces is good, or 750 mils. And then once they get over a year, 500 mils or 2 cups is more than enough to support them in their growth and development until they're at age 2. And then you can switch to a 2% or 1% milk. But you want to stay on the homogenized until that age. Because milk has no iron, and iron is very important and needed to make red blood cells and carry oxygen, and that's how it helps with that growth and development, we don't want to overdo milk, because we want to make sure that our nutrition is balanced and that we're getting lots of different nutrients from very many different foods. So sometimes if you do feel like your baby's drinking too much milk, or you think it's affecting their appetite, we do recommend that you offer food first at meals. Let them at least finish maybe half of their food before you offer them a half a cup of milk or so. And it is a good idea to offer milk with every meal and snack. Some people ask, what if my toddler doesn't like milk? So especially some babies, when you're first transitioning maybe from less breast milk or formula to homogenized milk, some babies may not accept that right away. So you can do a mixture if you are using formula or breast milk. You start mixing, so say you give 3 ounces of breast milk, you put in 1 ounce of the homogenized cow's milk, and until babe gets used to the taste, you can keep going. So then 2 and 2, 3 and 1, until you have them accepting the cow's milk. If babe is older than that and is still not drinking milk, you can just keep offering it and offering it. You can try different strategies for flavoring it different ways, adding a little bit of chocolate in there. Or if you really can't get babe to take the milk at all, then you can keep them on their formula until 24 months. But we don't recommend that. It's expensive and it's not needed if they're eating a variety of foods. However, you can do that if they're not taking in any homogenized milk. If you find you're still running into trouble, I would suggest getting in touch with your doctor. If he or she is a part of the Hamilton Family Health team, you have access to a dietitian who could really do a full nutrition assessment. Too much milk and not enough iron-rich foods can lead to anemia. So anemia can be quite serious and prevent growth and development. So we want to look for the physical signs of iron deficiency anemia. Pale conjunctiva would be like on the inside of the eye right here is pink. If you're noticing that inside your baby's eyelid there is more pale or white or skin toned, that may be a sign of iron deficiency. If you get them weighed and checked at your doctor's office and you've noticed a drop in growth rate, then that might be another sign that there's some iron deficiency. And worst case scenario is if we let the iron deficiency go too long, there can be long-term effects on brain development. Behavioral signs you might notice in your babe would be they're not playing like they used to, they're really clingy and irritable, and that's ongoing. So if you add up all of these signs together, it may be iron deficiency, and you want to talk to your doctor about that and come up with a plan of what to do. So we get to ask this question a lot. Can I give my baby other milks, like almond milk? So plant-based drinks are not recommended because, like I said before, babe needs a fair amount of protein and fat for growth and development until they're 24 months. So almond, coconut, rice, or hemp beverages are quite low in protein and fats, and they don't provide the nutrients needed for adequate growth in children less than 2 years of age. So for example, 1 cup of almond milk has 1 gram of protein, whereas cow's milk has 8 grams of protein. So quite a big difference. Soy milk does contain protein, but it's still too low in fat. So like I mentioned before, we really move with homogenized cow's milk or the goat's milk if it's pasteurized and fortified with vitamin D. When is my child ready to drink from a cup? So we usually say that when babe is ready for solid foods at 6 months, they're also ready to start learning how to drink from an open cup. A lot of parents are surprised that we recommend open cup just because, again, mess. However, in order to learn how to drink from an open cup and develop those oral mouth muscles and skills, that babe does need to start at a young age with an open cup. We don't recommend sippy cups because you actually use quite different muscles to drink from a sippy cup than you do from an open cup. And so for long-term development of those muscles, we recommend an open cup, obviously with some assistance at the beginning. 9 months of age, you can start weaning your baby from the bottle. And at 1 year of age, you can celebrate being bottle free. So a lot of parents may even gasp that sounds a little young, but we do encourage to start working on weaning off the bottle at 9 months, because staying on a bottle too long can also delay or affect some of that muscle development in the mouth for drinking from an open cup and for self-feeding and all other kinds of things like that. So how can you start weaning babe from a bottle? So it takes patience and a lot of persistence. You know, expect that it's not going to be, for most babies, it's not going to be a smooth, easy transition, but it can be done. And babe is, you know, young enough that they'll never remember you doing this to them because it feels very, very bad for them at the beginning. So what you can do is you offer food first at meals and milk second. So you may start offering milk in an open cup at meal times. So that homogenized milk if they're over the 9 months of age and well established on iron-rich foods. So you can offer the milk first. And offering water in a cup between meals, and so keeping milk just for meal and snack times. One thing you can do is pick one meal to remove the bottle and offer milk in an open cup. So maybe you start with lunch or whatever time of day you think your baby is most likely to try something new. And then you can start working from there. Once they're taking it at lunchtime and taking in a fair amount of milk, then maybe you pick another bottle in the day that you're going to start switching to an open cup. Another strategy some parents have done is they offer babe their formula, breast milk, or homogenized milk in an open cup. Babe takes a little bit, and whatever they don't finish, they put in the bottle and they let them finish their feed with the bottle. But we always still want to be showing and encouraging that open cup from the early days. And then you can slowly transition away from bottles at all meals, and hopefully they're drinking all of that milk that they need by then. Do I need to give my baby a vitamin D3 supplement? The answer is more than likely yes. So if your baby is exclusively breastfed, they need 400 international units of vitamin D. This usually comes in a drop form. Even if babe is on formula, you want to read the label on your formula and ensure that it adds up with the amount that the babe drinks in a day to 400 international units of vitamin D. If it doesn't, you may need to top up with a supplement. Vitamin D is not very prevalent in our food sources, and that's why we recommend supplementing at all different stages of life. There's some in fish and some in milk, but still we don't usually get enough, and we want to continue to offer a vitamin D supplement. We get some vitamin D in the summer. However, because we wear sunscreen, that blocks the vitamin D production in the skin. So we don't actually, very important to wear sunscreen. We're preventing other problems, but you're not going to get a lot of vitamin D that way. So again, a supplement is a great way to get your vitamin D. Picky eating is a very, very common thing that comes up when we see families at the office. So one thing you can expect that after a year, growth really slows down. So babes are growing at a very, very exponential rate of growth up until a year. That does start to slow down a little tiny bit. Their iron needs also reduce. So from 6 to 12 months, they need 11 milligrams of iron per day, whereas after 12 months, that reduces down to 7 milligrams. So once they get over a year, you'll start to notice maybe that appetite is changing a little bit too, because that growth is slowing down a little. So it may be normal for your little one to eat a ton one day and eat very little the next day. Sometimes they're very active and busy and curious, and so they're only going to sit for about 15 to 20 minutes at the table, and they will do about 90% if they're eating within that time frame anyways. So whatever they've eaten, you take them out of the chair, let them go, knowing that you're feeding them every 2.5 hours. They have another snack or milk or something coming up in a short time if you don't feel like they took in as much as you think they should. They're also very easily distracted, so you want to put away toys, turn off the TV while eating, and try and encourage them to be very mindful when they're eating. And you are very, very important for preventing picky eating. So you want to set a good example, be a good role model. Eating healthy and at the table and not distracted and mindfully yourself is a great way to raise a child that does the same thing. When you can, sit down and eat together your meals with the whole family, and try to keep meal times happy and calm. So talk about your day, We really don't encourage, reward or punishment for food. So encouraging to eat more when the child is saying they've had enough, but allowing them that 15 to 20 minutes to sit with their plate and see what they can do. And that may change every day. How can I encourage my child to eat well? So some things you can set up that really will help your child to eat in a healthy, well-balanced way is to have regular meal and snack time. So that routine and schedule is really, really important so that you have many, many opportunities in your day to offer your child a nutritious food, meal, or snack. Sit down and eat together, like I said, and also respect their tiny tummies, that they're gonna do better than us adults. Sometimes we like a large meal, but we may only eat 3 times a day. Whereas they have a tiny tummy and they're eating more often, they only need so much when it comes to mealtime. So set your expectations accordingly. And we do encourage at this age, heading into toddlerhood, you offer 1 meal only for the whole family. So not making special meals because it's, little Tommy's favorite thing is peanut butter sandwich, but the rest of the family's having chicken, potatoes, and broccoli. We do encourage that his plate or her plate would be the same, just a smaller version as the rest of the family. Make every bite count with really healthy choices. So because they have tiny tummies, you want to make sure that every bite that they take is really packed with lots of nutrition. And you can also offer foods in a fun way. So maybe on a nice plate that they like to use. You can cut vegetables and fruits in different shapes for them. They tend to like those things a lot. You do want to limit foods high in added sugar, salts, and fats, such as juice, pop, cakes, chips, and chocolate. Having these foods sometimes is okay, but we don't want them to replace opportunities to have really nourishing foods on a regular basis. And let your child decide what and how much to eat. So it's up to you as a parent. It's up to you as a parent to decide when, where, and what your child is offered. So you come up with a routine and schedule. Ideally, we recommend up to the table for all meals and snacks, whether that's in a high chair or in a chair, and that you decide what's being offered. So the same meal for the whole family, and you also decide what those other meals and snacks in the day look like. And then it's going to be up for your baby to decide, once you've set up all those parameters and the food is in front of him or her, to decide if they're going to eat the food you offer or how much they're going to eat in that moment. And that may change every day, like we talk. Children are very good at regulating their intake if they're set up with all of these parameters in the right way, with a good routine to allow for hunger to come, yet feeding often enough that they're getting the right nutrition throughout the day. We call this responsibility the division of responsibility, of separating what mom and dad or caregiver is responsible for and what babe is responsible for. Sometimes as parents, we take over the how much the child is going to eat because we worry about their growth and development, but that sometimes can come with rewarding or punishing around food, and we don't encourage that. Safety is very, very important when we're talking about eating. So you want to never leave baby alone while eating. You want to stay in the room, ideally sitting with them, eating as well. You want to ensure foods are appropriate texture for their age. So you want to avoid hard or round foods like popcorn, whole carrots or grapes or hot dogs. Those can all be choking hazards. And you never ever want to serve foods when baby is crawling, cruising, or toddling. Their mobility is a little bit wiggly at this age, and they're very unsteady. And if they were eating, that also increases risk of choking. One safety thing or one food that you do want to avoid giving babe until they're 12 months of age is honey. And the reason is that honey, whether pasteurized or not, can contain bacterial spores that if babe ingests, babe's immune system isn't strong enough before 12 months to deal with those spores. And those spores can make babe very sick, and in worst case scenarios can cause some paralysis. And so we get asked a lot, like, it's 12 months now, why is it okay at that point? At that point, your baby's immune system, especially in their gut, they're probiotic, have developed enough to be able to deal with those bacterial spores if they're ingested. And so the risk of getting sick is very, very low. So after 12 months, that's okay. Speaking of other foods to avoid, allergies come up a lot. We all worry and hope that our children don't have allergies, but they're out there and becoming more prevalent. So a lot of times parents ask us if they should avoid giving their baby any foods to prevent an allergy, and the answer is no. Research has shown there is no need to delay the introduction of high allergen foods like egg, fish, or peanut butter. The Canadian Pediatric Society recommends introducing these foods at 6 months, even in infants at high risk for allergy. They find it helps improve their tolerance to the food. So when you're ready to introduce an allergen food, what you want to do is you want to introduce it in very small amounts. So as an example, you take a little peanut butter and maybe rub it on the inside of their mouth. And then you want to watch for any reactions after they've had that food. So reactions can range from mild to severe. Milder reactions would be some rash around the mouth or anywhere, hives. Worse reactions could be diarrhea, vomiting. And then in worst case scenarios, wheezing, shortness of breath. If you see any of those more severe signs, you want to head to the urgent care, call your doctor's office right away. If you see hives and rashes, that might be also something you want to make an appointment and come in and talk with your RD or your doctor. If you see no reactions to the food, you wait 2 days before you introduce another high allergen food. And once you see no reactions, we actually encourage you to continue offering those foods that it helps babe keep up that tolerance to those high allergen foods. Oh, constipation is another thing that can come up a lot in little ones. So we get asked a lot, my baby's bowel movements are hard and pellet-like, what should I do? So first of all, what is constipation? So especially in babies, it can be normal for them to have a bowel movement 3 times a day, or they could have a bowel movement every 3 days. So not going as often is not constipation. So what you want to look for constipation really is hard pellet-like stools that babe is possibly having some pain trying to push out. If you see any blood or mucus, you definitely want to go see your doctor about that. But if babe makes a funny face when he's going to the bathroom, that's quite normal. And you will see changes in stool when you introduce solid foods or when you introduce new different foods. And so it's normal to see changes, but if you're having hard pellet-like round, difficult to pass stools, that is constipation. And what can you do about that? So you can increase your baby's fluid intake. So if you're breastfeeding, you could breastfeed more frequently or offer 2 to 3 ounces of water between meals. So you increase their fluid, that helps to make the stool easier to pass. The other thing you can do is offering higher fiber rich foods, including fruits, vegetables, and whole grains. So pears, apples, berries are great, whole grain toast, whole grain cereals, squash and brown rice. So lots of different things you can offer to help make that stool easier to pass for baby. Alrighty, so we covered a bunch of different topics for the age of 9 to 12 months today. So we would encourage you to set a goal. So depending on where you're at, maybe your goal would be you're going to do a little more texture progression, or maybe your goal is going to be, you know what, we need to start having those family meals with babe. Wherever you're at, we would like you to come up with one thing you're going to do this week that comes to feeding your infant. Very important to identify nutrition issues early. We do recommend that when you come in for your 12-month well baby visit with the nurse to do immunizations, we also encourage you to book with your dietitian at the same time to talk about any potential issues you may be having or just ensure that things are going well. You can join our next online infant feeding group, which you can find on our Hamilton Family Health Team website. And you can also share with other new moms and dads and see their experience. Lots of value there. If you do have a nutrition question, I am going to take questions at the end of the session, but if you do have a nutrition question, you can email the dietitians at the Hamilton Family Health Team, www.hamiltonfht.ca. You can book a phone appointment with your family doctor, dietitian, or nurse. You can join the next group, like I mentioned, and also some reputable websites that we like are dietitians.ca, unlockfood.ca, and beststart.org. Great information on there. We are going to launch some polling questions right now. There we go. Give you a second to answer those polling questions for us, if you don't mind. All righty, thank you. Okay, so time for questions. I'm going to open up the chat and see if there's any questions there that people have. Alrighty, so some common questions that I get in clinic when I see new parents is they ask about, you know, my kid won't eat any vegetables. What should I do? It's very common. Really, it comes back to that division of responsibility that we talked about, that as a parent, it is just up for you to provide those vegetables on the plate, you know, at snack time and meal times. It's often throughout the day that you feel is good for babe. You can also try offering it in different ways, like we mentioned, those fun ways, cutting the vegetables in different fun shapes. Really important to role model. So if you're not eating broccoli, little Tommy's probably not going to learn to eat broccoli if he isn't already. So making sure that you're eating those foods in front of babe. Some parents will, and I have myself, hidden some of those vegetables into, you know, mixed dishes and things like that. If you do want to take that route to ensure that babe is getting those good nutrients from the foods, that's fine. However, I do recommend if you hide it in the food, you also put it on the plate so they visually see that that food is there, which over time helps to send the message, you know, this food is healthy and we're eating it. So it needs to be on the plate to send the right message. And another thing I get asked about is throwing food. So at this age, sometimes, especially if you put a food that maybe babe doesn't like, parents ask me all the time, how do I get my kid to stop throwing the food away or on the floor? You know, so what I do recommend is you keep picking it up, you put it back on the tray or the plate, and you say, you don't have to eat this, but it needs to stay here. It's a part of your meal. So if they throw it again, you keep calmly saying, nope, we're not going to throw our food. It's going to sit here, but you don't have to eat it. We find taking the pressure off babe that they're not expected to eat it and that it's their choice to eat it or not really helps them. They're throwing it away, I believe, to get it away so they're not pressured to eat it. So that's how I would approach if they're throwing their food. Also get asked a lot about choking and, you know, a legitimate concern for parents. We do recommend parents get certified in infant and child CPR, just so you are well equipped if it ever happens. However, gagging is not choking. So quite often it can be very scary to hear your little one gagging. Gagging makes noise, and it's actually babe learning how to eat and swallow in a safe way. Choking makes no noise. So if you hear gagging, I know that can be worrisome. It's actually a good thing that they're learning how to not choke. And yeah, try to stay calm with them while they're doing that. Do you have any other questions there? I don't see any other questions, so we're going to finish off today. Like I said, if you do have any concerns or questions, you can get in touch with your dietitian at your family doctor's office. All right, thank you for attending today.